Good morning and welcome to our Food Allergy and Anaphylaxis Allergy Education Workshop. This is the first session in the 2026 series. My name is Megan Ahmad. Thank you for joining us today. I would like to thank our sponsors for making this event possible. For any queries, please email admin@allergyfoundation.co.za. The recording of today's webinar will be made available to anyone who's registered. The program today will be led by an awesome panel of experts. For any medical professionals in the audience, please note that this is not a CPD event. Before we get started, I'd like to go over some basic housekeeping. This is quite important, especially for those joining us for the first time. The taskbar may be seen at the bottom of your screen. Our audience is muted and will remain muted for the full duration of the session today, and we will not use the hand up function. Instead, we encourage you to post your questions in the Q&A tab. Our panel of experts will answer questions during the masterclass. You may use the React button to interact with the panel by sending your reactions. The resources, including today's program and other content, may be downloaded from the Resources tab. Also, feel free to visit the links that we've included. To access the recordings of the previous workshops, please scan the QR code. Email laik@allergyfoundation.co.za for more information. Also follow us on social media and sign up for our free newsletter to receive updates. Our next session takes place on the 23rd of May, focusing on asthma. Please visit our website, and that's www.allergyfoundation.co.za to learn more about what we do and what we offer. Sign up for our free newsletter, browse our articles and free downloadable content, and explore the products under the AFSA seal of approval. Visit the AFSA shop to purchase our in-house products, such as the AfriSpacer device to use with an inhaler and the Kitty Calmer range of eczema clothing for children. Our eczema advocacy efforts continue to grow. Medical aids in South Africa are falling short on chronic care. Scan the QR code, sign our petition today, and join hands for real change. Don't let eczema go uncovered. If you would like more information on the eczema advocacy, feel free to visit our website as well. And lastly, before we continue the program, I'd like to mention that we have awesome prizes up for grabs today. Today's winners will be randomly selected and announced live at the end, so please do stick around. And just before I hand over to our first speaker is Idonet van Sail, I just want to play a very quick promo video, so please just give me a moment to load that.
Looking for products that are safe for allergy sufferers? The AFSA seal of approval is here to help. This trusted seal is awarded to products that comply with our strict quality criteria. Look for it on body care products, air conditioners and purifiers, medical bracelets, nasal sprays and washouts, eczema clothing, cleaning products, and many more. Choose your products with confidence. Look for the AFSA seal of approval or visit allergyfoundation.co.za to view the available products.
Okay, thank you so much for your attention. We are going to kick off with our program today. Welcome, Idonet.
Thank you so much, Megan. I'll switch on my camera now. I just quickly want to share my screen first. Okay, can everyone... Sorry, just hold on a second. I'm just opening the correct one. Okay, can everyone see my screen?
That is perfect.
Okay, good morning. So my name is Idenit van Zyl and I'm a registered dietitian. I've got a private practice in Potchefstroom, but I also consult with patients online. And then I'm also involved with student training, and I'm very passionate about the field because we are a family living with food allergies ourselves. So yes, with that said, I'll start my presentation. Okay, sorry, I'm just trying to go through the progression. Okay, so we will be covering the following topics today: understanding food allergies, and also looking at the difference between a food allergy and an intolerance. Also, we'll be looking at food allergy symptoms, and also exactly how to avoid foods. I'll also talk a little bit about what a food challenge is, and also the management of mild and moderate or mild versus severe food allergies. Please note that the topics that will be covered will be done very briefly, and it's not an in-depth lecture because it's just, well, presentation is only 20 minutes. So hopefully we can cover, the most important things. So when I consult with patients also, I like to use 3 analogies. The first one is that when you work with food allergies, or you being a food allergic family or being a food allergic individual, it's really essential to take some time and it's almost like taking a magnifying glass and investigating everything in detail, because with food allergies, it's often, many things are often overlooked. The culprit food causing symptoms, for instance, or there's often a delayed diagnosis. So it's really essential to make sure that everything is considered. And also working with food allergies or be living with food allergies, it's not that simple. It's not a one-dimensional image. It's almost like a puzzle with 1,000 pieces. And there are so many things to consider. But it's only once all of those puzzle pieces fall into place, that we can help and facilitate optimal management of food allergies. Another important thing to remember is that your food allergy journey is not the same. You might be living with a peanut allergy, but your allergy journey looks completely different than another one living with peanut allergy. And that is why it's actually so harmful to try and get information online, because often information online is not individualized. So it's really important to make sure that your allergy journey is dealt with on an individual level. Okay, so a food allergy is when the immune system mistakes a harmless food for a harmful substance, and then the body has an immunological response to that, causing symptoms. The difference between, for instance, a reaction like a once-off reaction to food that's been outside for a while, or something like food poisoning, is that food poisoning would occur once, whereas when you're allergic to a food, the symptoms would present reproducibly. The most common allergens, and these ones are also the ones that occur on our South African labels at the contain section. They include cow's milk, soy, egg, peanut, tree nuts, wheat, fish, and shellfish. So those are the main ones globally, that globally most patients react to. And so of course, if you're not allergic to one of those, and allergic to something like corn, it's much more difficult to read food labels in our country, because you would have to find the ingredients in the ingredient list. But we'll have a little bit of a discussion on reading food labels as well. So food allergies are on the rise, and there are many theories why. Definitely something coming to light is the increased intake of ultra-processed foods, and alongside with all about the microorganisms that we're exposed to. But unfortunately, there isn't only one culprit. There are many factors that play a role. So at the moment, the statistics says that around about 2 to 10% of the population is food allergic. And also the risk of food allergies are increased when both parents are allergic. So if you have a child, or let's say often when I consult with parents, I would ask, as the mom, was the mom allergic? Was the dad allergic? And we just then understand that it is a family that is at an increased risk of having allergic children as well. So in children, the most common food allergies that we see is cow's milk and egg. but there are others as well, including soya. And then reactions can vary between immediate reactions and delayed reactions, and that is often what makes the diagnosis so challenging. And as I've mentioned, allergic reactions to food, if it is an allergy, is that the symptoms are reproducible. It's not only a once-off reaction, and it's, that doesn't occur again. So if we look at food allergy prevention, I think that is something that we really hope that we can get to one day, is to be able to prevent food allergies completely, but we are not there yet. So at the moment, what we do know is that it helps to, especially during pregnancy, but also not only during pregnancy and breastfeeding, but also for the allergic individual, to make sure that they consume a healthy and a diverse diet, because that actually supports the microorganism that lives in your gut. And by supporting them, we call it prebiotics. So by feeding them the prebiotics that they need, they can flourish and hopefully create a more anti-inflammatory environment, as opposed to an inflammatory environment when a big percentage of ultra-processed food is consumed. And then this is research that's been available for a few years now, but it is very important to introduce allergenic foods to children, preferably before the age of 11 months. And the ones that are specifically included, focus on including early, are peanuts, egg, milk, and soy. And also good skincare. We also now know that by taking care of the skin, we also reduce the chance of being food allergic because of sensitization through a skin that's not, or skin integrity that's not healthy. And as I've mentioned, to limit ultra-processed food, and I'm very passionate about the knowledge regarding food additives also. And we are learning so much more in terms of what additives are doing and the adverse effects of it. So ultra-processed food, including preservatives and artificial colorants, has been associated with an increased risk of food allergies and many other health disorders. And artificial food colorants specifically have been linked to disruptive childhood behavior and exacerbated ADHD symptoms. And it's just something that we cannot ignore. And I would really advise you to start reducing. It's not as easy as, to really avoid additives completely, but if you can at least start reducing your intake and your family's intake, that'd be a fantastic start. So let's have a quick look at the difference between a food allergy versus an intolerance. So as I've mentioned, if you have an adverse reaction to food, it could be toxic, where it's food poisoning, for example, or it can be a food hypersensitivity. Now, an allergy, and we'll have a look at it a little bit later as well, but an allergy is differentiated from a food intolerance, as including things like histamine intolerance or a lactose intolerance. And as I've mentioned, allergy symptoms can occur immediately after consumption of the food, but they can also be delayed, even up to 72 hours after consumption, depending on the type of allergy. So in practice, we often are asked the questions, are lactose-free products safe for my child with cow's milk allergy? And I've also seen many babies that, that's been placed on a lactose-free milk for the treatment of a cow's milk allergy, because there's such confusion regarding the difference between the two. So I hope to clarify the difference a little bit. And this is something that I also explain to patients when I see them, is that a cow's milk allergy is a reaction to the protein in the food, whereas a lactose intolerance is a reaction to the carbohydrates in the food. Now, regarding an allergy, it does not only involve the gastrointestinal system, including symptoms like abdominal pain, diarrhea, nausea, and flatulence. So those symptoms can also be allergy related. But often, there are other symptoms that the child or the adult experiences, not an intolerance, because lactose intolerance is located to the gastrointestinal tract, because it's because of the lactase enzyme that's deficient. And because of the deficiency in lactase enzyme, those individuals cannot tolerate or digest lactose in milk properly. And also another interesting fact is that lactose intolerance is uncommon before the age of 2 to 3 years in children. So if there's a child that's younger than 2 years and it's suspected that milk is a problem, it's most probably not the lactose, but rather the cow's milk itself. And cow's milk allergy symptoms also often occur quite soon after birth, with most of the children having symptoms by the age of 2 weeks after birth. So if a true cow's milk allergy is diagnosed, lactose-free products would not be suitable because the cow's milk protein is still intact and cannot be tolerated. So an immune reaction would still occur to the protein in the cow's milk, whereas lactose-free products would be suitable for someone with a lactose intolerance because they are just not able to digest the carbohydrate lactose. So I hope this helps to clarify some of the confusion. Another question that is often asked is if food can affect my child's behavior. And I've seen many parents that would say, I see every time my child consumes a specific food that afterwards their behavior just, they become unrecognizable in terms of what they do. And the answer is definitely yes. Now, firstly, if we look at food allergy symptoms can include, and I'm sure all of you who are attending today would know this because you are probably living with these symptoms. So upper respiratory symptoms like sneezing, running nose, congestion, conjunctivitis, and airway symptoms like a shortness of breath, a wheeze, coughing, swelling of the throat. Gut symptoms we often see, especially in children, nausea, vomiting, diarrhea, stomach pain, bloody or mucousy stools, and even constipation, which I'll also talk about a little bit later. And then fussy eating. So interesting fact is that approximately 90% of children with food allergies are also food aversive or have feeding difficulties of some sort. And then also skin symptoms, including hives or urticaria or angioedema, skin rash, itching, and then in severe cases, hypertension and lethargy. Now, all of these symptoms, you can imagine, especially the children with eczema, they really battle, and their behavior is often affected due to discomfort, pain, and the emotional impact of living with food allergies. Children often feel socially isolated at child's parties, and it is really a multidimensional condition to deal with, and that is why we would like to offer support, and that is why AFSA actually exists, is to offer support to people living with food allergies. Now, another question that is often asked, and I must say that I've seen so many children who are chronically constipated, and it also feels like it's on the increase. And so the question is, my baby or my toddler is chronically constipated. Could it be food related? And the question again is definitely yes. Now, firstly, if you make sure that the foundation of healthy stools, or to ensure that there's healthy bowel function, we always look at fiber intake, assess the intake of fibrous foods and vegetables and fruits. We always have to make sure that the child is consuming enough water, not cold drink, water, and then also to make sure the child is physically active. Now, if all of those boxes have been ticked and any other medical conditions have been ruled out, then it is definitely worth a while to do an elimination period under the supervision of a healthcare practitioner, of course. But there's new research that's also come out last year that has actually classified constipation as a non-IgE mediated food allergy. But the short and the long is that we now understand that constipation is an allergy symptom, or could be, and that cow's milk and soya seems to be playing the largest role. But in practice, I've seen most of the children improving after cow's milk and cow's milk product elimination. Okay, so avoiding food, it's such a delicate topic because it's so easy not to avoid everything that is that's required to avoid. But on the flip side, I also see often that people avoid too many different foods without having to avoid that amount of different foods. So it's really finding the balance, and as I've said in the beginning, to make sure that it's an individualized advice, so that when you avoid a food, that you're avoiding the food because it does cause symptoms. So do not be very careful to avoid a whole list of foods because it's been recommended online. Rather, go to an allergy healthcare practitioner and do targeted avoidance, which means you avoid the foods that most probably are causing your symptoms. And that is something that a healthcare practitioner can help you with. So your quality of life is so important, and unnecessary avoidance becomes a very emotionally burdening situation. And yes, of course, by education, it really helps to make sure your family is also educated. So I often see families, and then the parents would say that they really struggle with the grandparents, for example, because they don't understand and they keep on giving the child the food that they're not allowed to have. So, I almost want to advise you to call a family meeting and say, listen, this is what we need from you. We need your support, because if everyone supports you, then it's just so much easier. Another question that is frequently asked is a little bit of allergen safe? Now, the answer is actually not that simple, because for instance, an IgE-mediated peanut allergy, a little bit of the allergen would definitely not be safe, and it could be potentially life-threatening. Whereas in let's say a mild IgE-mediated cow's milk allergy, some cow's milk baked products such as baked biscuits and muffins can be potentially tolerated. But it's something that should be discussed with your healthcare practitioner as well. It's important to understand the type of food allergy, because it's only then that you could optimally avoid the allergen. But if you are unsure and you have been diagnosed with a food allergy, it's always best to rather avoid all of the allergen-containing products. So please don't try to introduce, allergens on your own. Please, if you have had severe reactions in the past, please don't reintroduce anything on your own. You always have to do it together with a healthcare practitioner in a medically supervised space. Okay, so the cornerstone of food allergy is label reading. Now, label reading is actually, it feels like a science almost. It's much more complicated than it's, well, not supposed to be. It is complicated because firstly, the labels are sometimes really small. And I've read many labels, and I often wonder to myself, how are people supposed to read it? Like, I don't know when last you looked at the ingredients list on gum, like, those little packets, but it's almost unreadable. So it's important to also, like, the principle is to read it before purchase, again, read it before storage, and again, before consumption, because some of those ingredients might be overlooked because the ingredient lists are so long. Another concern that we have is that ingredients in a product can change without a company having to indicate it on the product. So your family might be used to using a product, and then all of a sudden you notice an allergic response, and it could potentially be a product that you're used to. So please remember to read your food label, even if it's a product that you are well familiar with. Then regarding the may contain that is indicated on the food label, that is also quite complicated in the sense that not all individuals could, potentially have to avoid may contain. It's really only in your severe food allergies that it might be recommended to avoid may contain products. But usually in your mild to moderate food allergies, the may contain products are safe. So I would advise you also just to have a discussion with your allergy healthcare practitioner, just to understand the level of avoidance that you need to apply. And it's also important to understand that the terminology for different allergens on labels. So it might be indicated that there's casein in a product, and we know that casein is from milk. So just make sure you understand that as well. Okay, and then the Allegro app is available in South Africa to help. It's like a tool to assist label reading. It helps to reduce the burden of label reading. And the app is undergoing a bit of changes and upgrading, and the final version will be launched at the end of the month. So when you dine, well, I think most of you would relate that it's almost impossible to go somewhere. It's just horrible. I know as a family, when my kids were younger, we just avoided going to restaurants altogether because it's just too complicated. But please, if you do go somewhere, don't speak to the waiter or the waitress. Please speak to the manager. But I almost want to say, just bypass the manager as well and ask them to call the chef. I've recently had an experience where I requested about ingredients at a restaurant, and the manager did not give the correct information. And I was so concerned for everyone living with food allergies. So please, even if you have to make a visit in the kitchen, they cannot avoid you from doing that. Make sure children's teachers and principals are well educated. It's very helpful to send children's own party packs to school to make sure there's something for your food allergic child to enjoy if there's a party that you didn't know of. And then also to have snacks with you wherever you go, because you never know if someone is going to have snacks available, and then you might have, end up not having anything with you. And that is a horrible situation. Okay, when we look at cow's milk protein allergy, that's also, as I've said, there's no way that we can do everything in 20 minutes. So I just want you to know that there are suitable and not suitable formulas if you're a mom that's breastfeeding. Some mothers have to avoid cow's milk, whereas others don't. And preferably you should go on that journey with your healthcare practitioner, because it depends on the how sensitive the baby is and the type of allergy that the baby has. And then, so the formula that's not suitable is the hyperallergenic ones, goat milk or mammalian milk, and lactose-free milk. So that usually the first choice of feed would be an extensively hydrolyzed formula, and in the very severe allergy cases, an amino acid formula. And then also recently, hydrolyzed rice formula has been added to the market, which is a thickened feed. And if your child is not allergic to soya milk is also available. Then a food challenge would be, especially for those specifically for those with severe non-IgE mediated allergies such as FPIES, or your severe IgE mediated allergies, or most IgE mediated food allergies. You would have to reintroduce food in a medically controlled setting. So please, as I've said, don't try to do it alone. And also, please don't delay for too long, because most food allergies, especially in childhood, most of them are outgrown. So it's important to make sure you reevaluate for young children every 6 months, and for older children and adults every year, to make sure that because it might be that you've outgrown the food allergy, and it's always worthwhile just going through the process, but please discuss it with your health practitioner. In terms of mild allergies, strict avoidance of food is the only way at this point to manage food allergies. There is food related desensitization available, but it's not something we'll discuss today, but it's something that you can discuss with your healthcare practitioner. Okay, home introduction can be considered for mild IgE mediated allergies and mild to moderate non-IgE mediated allergies at home. But it's also something that you should never do on your own. Please discuss it with your healthcare practitioner first. I will not be going through the milk ladder in detail. I just wanted to let you know there are ladders available that we follow the steps of the ladder when we do reintroduction at home. And as I've said, it's only for the ones that have milder or moderate, like non-IgE mediated allergies. And then it's a stepwise approach to reintroduce. We don't just reintroduce by giving fresh milk. We always start with the baked milk first. It's also helpful to keep a food diary to monitor your symptoms, so that it's a very valuable tool as well. So as I've said, that most children outgrow cow's milk, egg, soy, and wheat allergy, and most of them, as you can see, outgrow them by the age of 5. A few might present with the symptoms for longer, but most of children outgrow them, whereas your peanut and tree nut allergies, unfortunately, are often not outgrown. In terms of support, it is really important that you know you're not alone, firstly, and if you do feel alone, to join a support group, to reach out to moms or parents with food allergy kids, so that you can have a community. If you're allergic yourself, there's a food allergy support group, a Facebook group that you can join as well. And it's really important to make sure that you don't go through this alone, because it's definitely a burdening, emotionally burdening condition. And also make sure that your friends and family understand, and that you work with your healthcare practitioner to optimally manage your allergy, only avoiding the necessary foods and not avoiding foods that you could potentially tolerate. So to summarize, make sure you know what you're allergic to. It might sound simple. It might sound very, what's the word I'm looking for? Obvious. But we do find that oftentimes allergens that are unnecessary are avoided. So make sure you only avoid what you're allergic to. Understand and read food labels very carefully and repetitively. Make sure to follow up with your healthcare practitioner if it's a child every 6 months, and if it's an older child or an adult every 12 months. And to ensure optimal nutritional status, please visit an allergy dietitian. And then also be very careful of just, applying and implementing any information that's available online. Make sure that it's credible sources that you are referring to. And that is also why the AFSA website is available for very good scientific-based evidence. Thank you.
Thank you so much, Jeanette. We're going to move straight into our next presentation by Dr. Marsha Maharaj. Doctor, are you with us? And to our audience, please continue posting your questions in the Q&A tab. Our panel of experts will be answering as we go along through today's program. Thank you so much.
Hi, can you see my screen?
Yes, we can. We can see that, Doctor. You are good to go.
Okay, I'm Dr. Maharaj. I'm a pediatrician and allergologist, and I practice in Cape Town, and I also go to Joburg monthly. So I'm just going to switch off my screen, and then I would then start. Okay, so I'll be talking about anaphylaxis, which I feel is quite an important topic to know, because you need to know how to manage anaphylaxis. So we'll be going through how to recognize it and then how to treat anaphylaxis. So what is anaphylaxis? So we know that anaphylaxis is the severest form of an allergic reaction. It is life-threatening, so that's why it's quite important. And it's a systemic hypersensitivity reaction. So systemic means that there's more than one organ involved, and that the hypersensitivity is then an allergic reaction. It's rapid in onset, so it's not one that occurs with delayed allergies. So usually if you've consumed something that you're allergic to, you would then get symptoms within about 15 minutes and sometimes up to 2 hours. It is potentially life-threatening if it's not treated or recognized early, because it affects your airway, so you wouldn't be able to get air in. It affects your breathing, and it also affects your circulatory system. So you could collapse, you could faint, you could have your blood pressure could drop, and it can then be potentially life-threatening. And most of the time, when you have an allergy, you've got skin symptoms or mucosal symptoms like your lips and eyes, but sometimes you could have anaphylaxis without the skin symptoms. But if you know that you've consumed something that's likely or that's got that you might be allergic to, then you don't need to wait for skin symptoms. If you have severe symptoms, it's called anaphylaxis. So most deaths of anaphylaxis are due to patients or teachers or parents or even doctors not recognizing that you actually have anaphylaxis. And we often wait and wait. We delay, until we actually give the treatment, and that's actually what then can cause, that can be life-threatening. And then often we don't really know what medication to give when and how, and when we would use the EpiPen and when we'd use allergics or what and how long should we wait. So these are actually quite important things that we should know. So remember, anaphylaxis is not a laboratory test. It's a clinical diagnosis. So you see symptoms. We usually take a good history, and we see from the history, did this person actually have anaphylaxis or not? And most of the cases, it happens within minutes to hours after exposure to a known or a very likely common allergen. And there's no special tests that are required to make the diagnosis. So remember, with recognition of anaphylaxis, if you're exposed to something that you're highly likely to be allergic to, or something that you know that you're allergic to, so if it's like a peanut or an egg or milk or wheat, and those are the common things, if you've just consumed it or if the child has just consumed it, that's a very highly likely allergen. Or if you know that you're allergic to this and there might have been traces of this thing in the food that you've just eaten, that's the exposure. And remember, it usually happens within minutes or hours, within at least 2 hours maximum. So the likely allergens are foods like eggs. Eggs is quite common, and peanuts. And remember, with peanut is a legume, so you could also be allergic to other legumes like peas and beans. Tree nuts and things like sesame is actually quite common allergens as well. And then we all know about cow's milk, fish and shellfish. Fish and shellfish and fruits and vegetables usually occur later on in life, as well as mammalian meat. Mammalian meat is one of those that can actually have delayed anaphylaxis, and that can happen at about 6 to 8 hours after you've actually consumed a mammalian meat. Other allergens would be antibiotics, pain medications like aspirin or Disprin is very common, drugs that are used intraoperatively or even intravenous iron. We all know about bee sting allergy and wasp allergy. And then not so commonly is occupational allergens like wheat flour in bakeries, or even people that are fishermen. That can then have anaphylaxis. And then latex is usually people that are in the healthcare industry that can also get anaphylaxis and not just contact dermatitis from the latex. So mild to moderate allergic reaction affects the skin or the mucous membranes. So you have swelling of the lips, face, and eyes, or if you have just some abdominal discomfort and then vomiting, or if you have hives, which is urticaria, which are the rash on the that you see in the image, or even if you just have a little bit of a tingling feeling, that is a mild reaction. Anything that goes beyond the skin or anything that affects your breathing then becomes a severe reaction. So these would then be severe reactions. So if your tongue starts to swell, it would then obstruct the air that goes into your airway, and that would then be a severe reaction. Or if the person has just consumed something that they're allergic to and their voice changes, they become hoarse or they have difficulty breathing. Like I've said, swelling of the tongue, if you feel like a very tightness in the throat and you find it difficult to swallow your saliva, if you have that noisy breathing, the whistling sound, or you get this persistent cough from the irritation, or in some cases also if you have dizziness or collapse, if you see someone collapses or becomes floppy and they've just eaten something and they're not choking on something, then this could then qualify as anaphylaxis. So it's very important. So anything that obstructs your breathing, anything that causes your blood pressure to drop, so if you become extremely pale and you collapse, that is then a severe reaction. So remember, you don't always need to have the skin symptoms. So if you have the skin symptom plus you've got breathing problems in your lungs, like on the image on the left, you would then have anaphylaxis. Or if you have skin symptoms plus you collapse, or skin symptoms plus you have severe abdominal pain and vomiting, that is anaphylaxis. But sometimes there's no skin symptoms, and then you've just eaten something, and then the patient becomes extremely pale or they collapse. That is a severe reaction. Or they've just eaten something and they have difficulty breathing, or they become, they have airway obstruction and they have swelling of the tongue, or their voice changes, then that would then count as a severe reaction. So remember, you could still get anaphylaxis even without the hives or the swelling of the lips. So to put it together, to recognize anaphylaxis, if you've been exposed to something that's highly likely, or something that you know you're allergic to, common things like eggs, milk, peanut, wheat, sesame, and tree nut, shellfish, or drugs, antibiotics, and those type of things. Or if you've got you've been stung by a bee or a wasp. If the symptoms happens within minutes to hours, and the symptoms can affect the skin, where you get redness or flushing or hives or swelling of the lips or the facial area or around the eyes, or if it then goes beyond the skin and it affects the airways, you get noisy breathing, high-pitched breathing. Remember the whistling sound, like someone that has croup, or if they've got this persistent cough that's just not going away, and you've seen that the person is having difficulty breathing, wheezing, or a tight chest, or if they just they've eaten something and they just have this excessive sneezing, plus the runny nose, plus you know that these symptoms have just occurred, that is then could also qualify as part of the allergy symptoms. The gastrointestinal symptoms would be severe abdominal pain, cramping, nausea, vomiting, and then just diarrhea. And this happening just immediately after, but with other symptoms. So the gastrointestinal symptoms are a little bit tricky because sometimes they can be intolerance. Intolerance usually does not happen immediately, and usually it's not as severe. So if you've got someone that's just vomiting, and they have severe cramping, and you know they've just had this, it's more likely to be an allergic reaction than someone that has this discomfort, abdominal distension a few days later or bloatedness. That is then an intolerance. Remember, the cardiovascular symptoms would be when they faint, if their blood pressure drops, if they suddenly have some chest pains. That's then severe symptoms. And in kiddies, sometimes they just become really quiet, and you can see that they become floppy and they become pale, and you don't really know, and you know they've just eaten something. That then would then count as a severe cardiovascular symptom. It's easy with the things that you see, like the hives and the lips that might be swollen, but you also have to just look at the rest of the person. Sometimes they can have red, teary eyes or itchy eyes as part of an allergic symptom, or they have itchy lips or tongue or palate. So things that increase the severity of allergic symptoms could be cofactors. So sometimes you could be allergic to, for instance, milk, and maybe you've always just previously had hives, and then you don't really worry. You take an allergics before you eat. You go and have an ice cream, which is very unsafe. But maybe this day you decide to go and exercise, or maybe it's the time when you're on your period, or you have a flu, or you've just taken some gen pain for a headache, or you've now had some alcohol. Your previously mild symptoms that you've had in the past could increase in severity, and those things are called cofactors. So you shouldn't say, oh, well, my symptoms are usually just mild. I usually just get a bit of hives, so I'll just eat this thing. But now you're out in the park and you're doing all these other things, and you could actually have anaphylaxis unexpectedly, even if your previous symptoms were quite mild. So always be careful. Don't take chances and just decide, okay, well, I'll just bear with it, have a look. Or maybe the granny just decides to say, this child always just gets a rash. Maybe just give them a little bit of egg, and you know they're allergic to the egg. That is not safe behavior, because maybe that child has got an underlying infection, or maybe they're going through, their routine is out and they now travel to the granny, or maybe you've given them some Nurofen just before that. That can definitely exacerbate previously mild allergic reactions, and then can develop into anaphylaxis. So people that are most likely to have severe reactions called anaphylaxis are babies. So those ones below the age of 1, they often could have quite severe reactions. Adolescents, just because they've got risky behavior. So there's a little bit of peer pressure. Everyone's eating the same thing, and then they would just want to take it just to fit in, or they might just be experimental and use a little bit of might have had a little bit of alcohol and then had something that they might have been allergic to. So they've got quite risky behavior. Elderly people, because they're on often on a lot of drugs, and they could be on pain medication, and antihypertensives is quite a big thing. That could then make you at risk of more of anaphylaxis. And then, of course, pregnancy, just because your immune system changes. So someone that's pregnant, even if they've previously had mild reactions, could then get severe reactions. And then all the allergy concomitant diseases like eczema and allergic rhinitis that can make you have more severe allergic reactions. And then if you have asthma and you get anaphylaxis, the chances of you wheezing and your asthma getting out of control or getting an acute asthma attack is higher. So that puts you at a bigger risk of having more severe reactions. And then obviously illnesses like depression and mast cell disorders, that's more like mastocytosis. It's a bit of a complicated disease that we're not going to go into. And then obviously if you already have pre-existing heart conditions or hypertension and those things, you would then be at risk of having more severe reactions. So now to decide what to do when you have a reaction. So if you have mild symptoms, you should always stay with that person because you don't really know if what's going to happen. Is the symptoms going to get worse or are they going to progress? Try and get some help. Ask someone to call the mom. The moms usually know what's going on or how to treat the patient if you are a provider, or if you don't know, also just call your doctor. Find the EpiPen because you might need to use it if the symptoms get worse. So if it's hives, then you can give them some antihistamines. So remember, antihistamines treats hives, but they don't treat deep systemic symptoms. So anything beyond the skin and the mucous membranes needs to be considered anaphylaxis and then would need the EpiPen. And then obviously you then phone the emergency contact person, which is often on the action plan, which Mimi would then talk about. Okay, so that would then be the mild allergic symptoms. So remember, mucous membranes and urticaria, which is called hives, that is mild symptoms. Anything beyond that, or even with that, is then a severe allergic reaction. Okay, so what you do is you let the person lie flat. What it does is it helps the person blood pressure not drop, and also the person won't collapse and hurt themselves. You still scream for help because it's always better to have someone with you. Don't wait before you give the adrenaline. If you're not sure, and the patient has got severe symptoms that are in keeping with severe allergic reaction, you give the adrenaline, okay? And then you call the ambulance and you phone the emergency contact person and you transfer the person to the hospital. The reason we transfer you to the hospital and let you wait for to be observed for additional 4 hours is because you could have a rebound anaphylaxis, and also you need to get another EpiPen from a healthcare provider. And sometimes the dose is just not enough for your symptoms, and you might need to get additional doses. Okay. So how do you give the EpiPen? Okay. So the dose, you get an EpiPen senior and you get an EpiPen junior. So the EpiPen junior is used for kids below the age of below the weight of 25 kilos and above the weight of 7.5 kilograms. and that one is 0.15 milligrams, right? Even in children that are above 25 kilograms and adults, obviously, you would then need to get the EpiPen senior. So junior below 25 kilograms and then senior above 25 kilograms. If you're a biggish person or you're an adult of 70 kilograms or so, you might need to have 2 EpiPens because one dose might not be enough, okay? So remember, the EpiPen usually has some fluid in it. If the fluid is milky or if there's any particles in it, it's not going to be effective. Remember always to check the expiration date. Don't ever put your EpiPen in high heated conditions. So you're not going to let the EpiPen lie on the sports field in your kid's bag. It becomes less effective. So if the kid it can be at room temperature, but if you're going to be playing sports or if you're going to be traveling, rather put it in a little bit of a cooler box with the antihistamines and also with the Astavent or the asthma pump if necessary, if the child has asthma or if they've previously had wheeze. Okay, so have a nice little lunch box or something just to carry it. And then what's also good to have in that little lunch box is an action plan in case someone needs to read how to use the EpiPen or who to contact as well. Okay, so those are just practical things for the EpiPen. So remember, when you've got your EpiPen, it's a single use. So you have to be confident when you use it. Do not be scared. If the person needs it, you would rather use it than wait. Okay, because you never really know what could happen. Is this a life-threatening anaphylaxis, or how if you wait too long, it might not respond as well to adrenaline. Okay, so remember, blue to the sky, that's the blue cap on the top, and then orange to the thigh, that's the bottom. So you're going to keep it as if you're holding a dagger. You're going to lift up the blue cap, and once you've lifted that blue cap, then the EpiPen is now activated. Okay. Remember, it is not a swinging reaction. It is a firm reaction into the upper outer thigh. So remember, you can also go through clothes as long as it's not thick, heavy things, but the needle is quite long. So you could then go through the clothes and you don't have to remove someone's clothes to administer the EpiPen. And it's on the upper outer thigh. Okay, so you could also do that. You hold it in place for at least 3 to 5 seconds, just because you want to be sure that the medication has gone in. Okay. If you decide to use the EpiPen, just use it. Do not be hesitant because you've only got one chance. So if you scared to use it, rather ask someone else to do it, that would then do it confidently. Okay. And remember that the dose can be repeated every 5 to 15 minutes, just because sometimes it's not enough for the person that's or sometimes you might just not have done it properly. So you can then, if the person still has symptoms of airway threat or they have collapsed, then you would then give the next dose within 5 to 15 minutes. Okay. So if you're not sure, just use the adrenaline, okay? If it is not going to cause the person it's not intravenous, so it's not in your arteries or your vein, so it won't cause the person to just die. It's a little bit uncomfortable. You'll feel as if you've had, as your heart is beating a little bit faster, but that is better than suffocating or collapsing and your blood pressure is just so low that you just can't you can't cope. So if you're not sure, rather use the adrenaline. Okay. Remember, antihistamines relieves the itch, the hives, the flushing, but it's not useful in anaphylaxis. Okay. So anything beyond the skin, use the EpiPen, and you can use your EpiPen and still give the allergics or the whatever antihistamine you've got. But first, if the person has anaphylaxis, use the EpiPen. The person just has hives or the person just has some mild itching, you can then start off with the antihistamines. Remember, steroids like aspalone and prednisone is not useful in treating anaphylaxis. The reason is because the onset is just too long. So, and then the symptoms are so progressive. So you can give the steroids after you've given the adrenaline. And so the adrenaline is the first line treatment. So we do not treat anaphylaxis with the steroids initially. It's only for later on once you've stabilized, okay? And remember, for the asthmatic patients or the patients that are wheezing, you give the adrenaline, then you give the pump. So if someone's allergic to peanut and suddenly they start wheezing, do not just give if the pump is there, you can give it, but get the EpiPen, give it immediately. That is what's going to take away the wheeze, not necessarily the asthma pump is not going to help as quickly if it's due to an anaphylaxis. Okay, so remember, important numbers is the municipal ambulance, which is the 10 177, ER 084 124, and then Netcare 911, which is the 082 911, which you then would then phone your ambulance for advice and also just to help you, okay? Remember, if the patient is unconscious and they're not responding, you give the adrenaline and you start CPR immediately after the adrenaline. And then you can repeat your adrenaline dose after 5 minutes, okay? And then the important thing is then to go to your hospital for at least 4 hours observation, just to see if the symptoms are progressive. Someone can have a look and see if is this person stable to go home? Do they need more adrenaline? But go to your healthcare provider or your hospital, even better, to just get an observation, and then also just to get another EpiPen just in case you get exposed again. Okay. And that's it for me. Thank you.
Thank you so much, Dr. Maharaj. That was an extremely interesting talk. Thank you to Idanet as well. And now we are going to do our last presentation led by Dr. Mimi Deetlefs. Dr. Deetlefs, are you ready to share?
Yes, I am. I'm just getting ready. Right, can everybody see my screen?
Yes, we can.
Okay, great. Good morning, everybody. So just to put if you can you see me?
Yes, we can see you. Your webcam is on.
Okay, just hello, and then I'm going to turn off my webcam. Oh, we're just going to leave it on. Good morning, everybody. So basically, thank you very much to our first two presenters and for the short introduction into food allergies and anaphylaxis. And I'm just briefly going to mention some patient resources. So often with allergies, the question is how I've got an allergy now. How did this happen? Why did it happen? What do I do now and where do I go to? And obviously, we all know Dr. Google, and it's easy to look around and just go onto Google. But one should be very careful about what you do and how you approach Google and what questions you ask, especially with the new things like ChatGPT as well, where you can ask AI questions. But it's very important to actually look for a professional advice and professional healthcare providers to assist in allergies, because allergies are quite complicated and you need to have expert advice when you start addressing these and look into those. So what I want to do today is basically introduce you to the AFSA website. So the Allergy Foundation of South Africa has a dedicated website to allergies, and I'm going to introduce this website to you. So some of the things, this is just the front page, and you can find the AFSA Foundation at www.allergyfoundation.co.za. And if you look at the top here, you can see you can have general information. There's a specific tab for allergy information, some inborn errors of immunity, and then there's a blog, and you can also contact us. And if you're starting out to look for information about allergies, please go to this website. This is where we are trying to, this is a website that has been built to educate people, to empower people. And the vision is basically to, AFSA strives to save lives, enhance the quality of life, and reduce the cost of healthcare in South African suffering from allergic disorders and primary immunodeficiencies. AFSA is a registered nonprofit company. It's also a registered public benefit organization. And then the foundation was established to create awareness, to advise and educate patients, and to promote responsible care. And we also assist with advocacy, and then obviously we need to raise funds for all of these endeavors, and thus we also do this via the website. But it is a non-profit company. So what can you find on the AFSA website? So there's an allergy professional search tool, which I'll show you just a little bit later. There's downloadable educational leaflets. You can actively find the Instagram, Facebook, and LinkedIn links to allergy information. Allergy safe products. There's a learning academy for healthcare providers. It's the AFSA shop, and I'll show you a few products which are essential for this talk. There's also a monthly newsletter where you can sign up and get allergy updates. It also gives you information about support groups, educational live events such as this, and then allergy education workshops as the one we're currently doing. So one of the important things is that you need to do when you've got an allergy. And the problem is here, when you start thinking that you've got an allergy, it needs to be assessed by someone who is trained in allergies. Often people have gone to some healthcare practitioners who then indiscriminately do some blood tests and then tell you you're allergic to eggs, nuts, milk, soy, fish, and everything. And this is not necessarily true. You need to see someone with expertise who's got the knowledge to interpret those blood results after talking to you. So first of all, every allergist and every healthcare provider in the allergy service will take a detailed history from you. It's essential to talk to you and actually listen to you, to hear what the problems are, how it happens, when it happens, the exact details surrounding each and every event. So in order to find someone like this, you can go to the AFSA website, and this is where we've got the Welcome to AFSA Find a Professional directory. And basically, this is a tool to locate a specialist in your area. And if you look here at the bottom, you can filter by specialty. So all the doctors listed on AFSA have got special interests, and you can screen that. They've got different areas of expertise, which you can also look at. You can search for specific doctors, and then you can also search by province and area. So very important to actually find someone that is going to give you the right advice and going to interpret all investigations and actually walk this path with you. So the AFSA website also has got information leaflets, and here is a lot of simple questions, but it's true questions, especially if you're starting out with an allergy. Even if you've been living with an allergy for a while, it's got leaflets about how common is true food allergy, and this is where you will get specific leaflets on alpha-gal, celiac disease, FPIES, cow's milk allergy, egg, fish, peanuts, soy, also on anaphylaxis and immunotherapy. Also can also get leaflets about cross reactions, how is allergy diagnosed, how is it treated. the non-allergic food intolerances, which we often see in allergy circles, which are not true allergies. And then obviously other food allergens and other related information. You can also get a food and symptom diary, which is very often quite very useful. So if you're suspecting that you might have a food allergy, it's quite useful to download a diary or to keep a diary yourself where you document what you eat, when you eat it, and your associated symptoms. If you take that to a healthcare professional, it really helps them to assess if there are any patterns there, if there are any specific food groups, or if it's completely unrelated. So very helpful, and you can find a food and symptom diary on the AFSA website. Then there's also the allergy action plan, and Marche actually mentioned this previously. This is a form that needs to be filled in conjunction with your healthcare provider. So it's got your basic information, and then it says it's got an area for the confirmed allergen, as well as family emergency contacts. And then it's got information that will tell you whether you've got a mild reaction and what to do when you've got a mild reaction or when it's a severe reaction and what exactly to do in a severe reaction. Now, this anaphylaxis plan, everybody who carries adrenaline in the form of an EpiPen or ampules should be carrying one of this with their adrenaline. It's also useful to provide this to your place of work as well as schools. So it's useful to send this to schools because it also gives an indication or information to people who might encounter you if you're not able to administer adrenaline yourself. So this is a backup plan that's essential and needs to go with adrenaline. Then on the website, there's also a chef's card template, and this is a card that you can print out and you can say, you can keep it in your wallet, you can have it laminated if you want to, otherwise you can just fold it and sellotape it. And on here, you write your food allergies, and it's useful to actually, when you go to a restaurant or when you go somewhere, to actually give this card to them to alert people to your actual allergies. It's quite a useful tool to have. Then on the AFSA website, you can also find instructional videos. So related to our talks today, for example, there's a guide to using an EpiPen. There's also learning about food allergy and anaphylaxis. And there's also how to use your AfriSpacer. And these instructional videos are very useful. And it's not only in terms of the topics we're covering today, but it's also got information on eczemas, for example, wet raps, rhinitis and sinusitis. And then we've also got patient reports as well, which you can have a look in. So really informative and useful. If we look at the shop, many of you don't maybe know this, and maybe you haven't seen it, but it's a good idea to go through the products that's actually available in the shop. And this is an interesting one where you can buy emergency QR code. And then on this QR code, you load all your medical information. And this you can carry on your wallet or carry on your person. And if ever in an emergency, someone can see this QR code, scan it, and access all your relevant medical information or allergy information. And this is a laminate sticker. Then the next thing, for everyone who lives with food allergies or has had anaphylaxis in the past, it's essential to have a medical bracelet. And AFSA has partnered with ice tags, and for a reasonable price, you can purchase one of these bands, and it comes and you specify what needs to be engraved on it, and this is very useful to always wear, and it's essential to wear these, especially in cases of severe food allergies, as well as previous anaphylaxis. So anybody that meet you or see you in an emergency situation, they can have the information on hand. And these you can find on the AFSA website. Then the AfriSpacer is also on the AFSA website where you can buy this, and this is essential for patients, especially for children, but for anybody using a meter dose pump inhaler for their asthma. So these spaces are useful in terms of delivering adequate amounts of medication, making it easy for you to actually inhale a proper amount of medication and a proper dose. And these have come in two forms, and there are also masks that you can use in terms of babies and infants who are not yet old enough to hold onto the AFSA and where you can assist. So this is basically an essential tool for people who use metered dose inhalers, especially those rescue inhalers as well. And you can find them on the AFSA website. Then there's also a wide range of information on the blog on AFSA. And you can sign up for the blog and you can peruse the blog. I've just included the first beginning of some of the blogs, but you can see this is we're only going to Alpha Gal here, but there's a topic that has been discussed in a proper amount of detail, not over discussed, but there's a lot of information that you can find on the blog. So also recipes, and you can also see about trials that are currently being conducted and that you can potentially participate in, and also about the research that's been going on in allergies. Also useful information about schools and allergies and how to manage that. So you definitely have a look at the blog. Then it's also very important and very useful to sign up for the AFSA newsletter and then to have the contacts of AFSA available. So it's really easy signing up for allergy updates and newsletters. You just provide your email address and your first name and your designation, whether you're a patient, healthcare provider, or a sponsor. And then if you have any questions and need information on anything, you're welcome to also email info@allergyfoundation.co.za. And it's very useful for us to actually broaden the scope of the website and improve things on the website and improve information, improve education, and improve care. And basically, we're here for you. So we want your questions that we can elaborate on the education, on the knowledge, and share it. Idunette has touched on this. There are also links on the AFSA website to, for example, the Food Allergy Support Group of South Africa. And this is endorsed by AFSA. And what it is, it's support for patients or parents who have children with food allergies. It's a private group. So anybody can find it, but it's not, you can't see the content. So you actually need to become a member of the group if you would like any information. But many of our healthcare professionals are actually on this group and monitor this. So it's quite useful to actually, when you have a question, to post it on this group. So very important and very useful. And that is all the information I have for today. Thank you very much for each and every one of you joining us. And we'd love to see some more questions in the Q&A.
All right, let's jump right in. You know, we've all gotten pretty good at the daily hygiene stuff. Washing our hands, brushing our teeth, all that. But what about the one place where we spend like a third of our entire lives? Yeah, I'm talking about our beds. The hygiene there, it's been kind of overlooked. And it's high time we took a much closer look. I know, that's a bit of a weird question, right? But it's a fair one. Because believe it or not, every single night there's a whole ecosystem, an entire world, thriving right under your nose that you probably have no idea about. See, while we're sleeping, our bodies are constantly renewing themselves. It's totally natural. We shed millions of dead skin cells, and they don't just, vanish. They fall right into our mattresses, our pillows. To us, they're completely invisible, but to something else, well, it's a feast.
So, let's do it. Let's pull back the covers and actually take a peek at this microscopic world that's living in every single one of our beds.
Okay, so who's the main resident here? Meet the dust mite. These little guys are actually 8-legged relatives of spiders, and their entire life happens right where you sleep. They live, they eat, they breed, all of it fueled by the skin cells we leave behind every night. And the sheer scale of this is, well, it's kind of mind-blowing. A single mattress can be home to as many as 2 million of these microscopic creatures. And look, this isn't about being clean or dirty in the way we usually think about it. It's just a biological process that's happening in every single home.
So you might be asking, why does any of this even matter? Well, if you're someone who suffers from allergies or asthma, or maybe you just can't figure out why you're sleeping so poorly, this unseen world could be the direct cause.
Okay, so here's the really crucial thing to understand. It's not the mites themselves that are causing your symptoms. It's their poop. These microscopic droppings contain proteins that dry out, get kicked up into the air, and then we breathe them in. And that's what can lead to inflammation, sinusitis, eczema, and that awful feeling of waking up just as tired as when you went to bed.
But here's the good news. This is a totally preventable problem. So let's talk about a real scientific solution, a medical-grade, totally chemical-free way to get right to the root of the issue.
The solution is basically a powerful 1-2 punch. First up, you've got HEPA-13 vacuum extraction. Think of this as the extractor. It physically removes the problem. It sucks up the skin flakes, the mite debris, all of it. Then you follow that with UVC germicidal light. This is the neutralizer. It shoots out a specific wavelength of light that basically scrambles the DNA of these microorganisms, making it impossible for them to reproduce. And does it work? Oh yeah, the impact is huge. Studies have shown that this combination can slash your exposure to dust mites and their allergens by up to 70%. That directly translates to cleaner air that you're breathing all night long. So let's break down that first step, the vacuuming. To do it right, you start by stripping all the bedding off. Then you vacuum the entire mattress, but do it slowly, in overlapping strokes. Really make sure you focus on the seams and the edges. That's where all the gunk collects. And this is super important. Empty the canister outdoors, so you don't just release all those allergens right back into your house. And the UVC light part, it's seriously impressive. It's completely chemical-free, which is amazing. It leaves absolutely no residue behind, and it's totally safe for all your bedding. It just neutralizes mites, bacteria, and viruses without any nasty side effects. It's pretty much the perfect solution, especially for anyone with allergies or sensitivities. Okay, knowing what to do is half the battle. So to make sure you get the best possible results, let's walk through 6 really common mistakes people make when they try to clean their beds.
All right, mistake number 1, and this is a big one. Using moisture. So using liquids or steam. It might seem like you're deep cleaning, right? But what you're actually doing is trapping moisture deep inside the mattress. You're creating the perfect, damp breeding ground for mold and dust mites. The better approach, always, is to keep the entire process completely dry.
Another common trap, trying to cover up the problem with scented sprays. A lot of those anti-allergy chemicals or air fresheners contain things called VOCs, volatile organic compounds, that can actually irritate your lungs. You have to remember, fragrance does not equal clean. The real goal is genuine hygiene, not just faking freshness. Next up, please don't assume that just washing your sheets is enough. Look, it's absolutely essential, but it's only cleaning the very top surface. The real reservoir of allergens is deep down inside the mattress and pillows themselves. You've got to combine clean linens with that deep hygiene. Okay, this one is absolutely critical. Using a regular old household vacuum can literally make the problem worse. How? It just sucks up the fine allergen particles and then shoots them right back out into the air through its exhaust. The only tool that really works is a vacuum with a true, medical-grade HEPA-13 filter that's actually designed to trap those microscopic nasties. And don't forget, your bedroom's environment plays a huge part in all this. Dust mites love humidity. It's like their lifeblood. So a really simple but powerful habit is to just air out your room every day. And if you can, try to keep the indoor humidity somewhere between 40 and 60%. It makes your bed a much less friendly place for allergens. And finally, the biggest mistake of all, it's just doing nothing. When you do nothing, you're allowing allergens and moisture to just build up night after night after night. The car analogy is perfect. If you never service your car, it'll still run for a while, right? But there's a growing cost to your health over time. So by just avoiding those common mistakes and adopting the right routine, you can genuinely reclaim your bedroom as a true sanctuary for healthy, restorative sleep. It really all comes down to changing how we think about this. Clean sleep isn't some kind of luxury. It's a fundamental, basic part of our overall health and well-being. At the end of the day, by understanding this hidden world, you're now in control. You have the knowledge to take smart, science-backed steps toward a life with fewer allergies, better sleep, and just better health. So I'll just leave you with this one question. Now that you know what's really hiding in your bed, now that the invisible has been made visible, are you ready to take control and finally sleep clean?
Thank you so much for your attention. If you are looking for any further information regarding AFSA and what we do, please do visit our website. That is www.allergyfoundation.co.za. Now I am happy to announce the winners of today's prizes. Congratulations to Ahmed Mayat. You have won the Mrs. Martin's Beat Allergy Starter Pack, valued at 600 Rand. And then Kara Morris, the book hamper valued at 650 Rand, will be en route to you shortly. Thank you so much for your attention today. Today's winners were randomly selected. Please remember to visit our website to learn more about the AFSA seal of approval as well. I will contact our winners directly via email on Monday to confirm shipping details. Thank you so much for your time today. I'm just going to play us out with a little promo video, but have a wonderful, wonderful weekend further, and we look forward to seeing you at the next one.